Good morning, and welcome to this week's episode of the Ask Dr. Murphy series. I hope everyone is doing well today. My name is Katie Berg. I'm a research study coordinator with the Havey Institute, and I'll be leading today's discussion. I'd like to welcome and introduce Dr. Robert Murphy. Dr. Murphy, how are you doing this morning?
I'm doing just well, thank you.
Dr. Robert Murphy is the executive director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases here at Northwestern's Feinberg School of Medicine. He answers your COVID, public health, and infectious disease questions each week here on the Havey Institute's Facebook page. Today, Dr. Murphy will be addressing the latest headlines and our lone COVID statistic through today, October 25th. We invite you to submit any questions you have down below or suggested topics via any of our social media linked in the description. Starting today with our abbreviated COVID statistic, average deaths per day in the last reported week were 98 daily. In the same week in 2023, we saw 199 daily deaths. Dr. Murphy, your reaction to that number, as well as the status of COVID in the country?
Well, the summer wave is coming down because these numbers really reflect people that got infected weeks ago. It took them a while to get sick, a while to get in the hospital, a while to go to the ICU, and they didn't survive. So the summer bump is over. Still, these cases, they're serious. You have almost 100 per day, but it's half of what it was a year ago. So, hopefully everything is just stepping down like that. So the summer wave is over, but now we got to get ready for the winter wave, which will start with the flu season in December.
And I understand there's been some more updates, not on how much the XEC variant has been popping up in the United States, but about the variant itself and its characteristics. Can you let us know a little bit about it?
Yeah, so it's all in the Omicron family. What's going on here? XEC is a very common one. KP.3.1.1 is still over half of all the new co-infections. But overall, that's not making any really clinical difference right now. And the wastewater sentinel surveys are low. So that means that, that summer wave is basically over. The variants that are circulating now are Omicron variants that work very well with the vaccine that's available right now.
And while we're on the topic of COVID, something that could be clinically important, there's a new trial out right now regarding a COVID treatment drug. Can you tell us about that drug and the results of the trial?
Yeah, this is a new drug. Like we have Paxlovid, we have Molnupiravir, we have Remdesivir, which is only IV. And we know that that does keep people out of the hospital and keeps people healthier and living longer. Now, on top of that, your own immune system helps you. So if you've had vaccines or you've had COVID or you've had both, you have a lot of immunity. So this study of this new drug, obeldesivir, it's an oral drug nucleoside analog, and it inhibits the viral replication of COVID. In a big phase 3 study with 465 patients, many of them many of them were over 65 years of age, and a lot of them had it was a whole mixed bag. Whether they've had vaccinations or COVID or whatever, it's just kind of a lot of them. And what they found, day 29, so 1 month after getting diagnosed, the hospitalization rate and all-cause mortality was 0.5% in the placebo and nobody in the treatment group. Now, that was statistically significant, but barely, and like you're just not seeing that many cases because of what I just talked about. The overall population is pretty immune. That doesn't mean these drugs don't work. That doesn't mean you don't get better faster. That doesn't mean you feel better when you take them. All that stuff is most likely true. And they did show that the length of time a person was symptomatic was less if they were taking the drug. Now, is that enough to get a drug approved? Well, we'll see. But there was a slight difference in the hospitalization and death rate that was significant but small. they also showed that the viral activity was lower in those that were treated, which makes sense because it's an antiviral drug. And it was considered very safe. So if it gets approved, that's yet another option people have. And it's probably just as good as what's already out there. So it may be a little bit easier to take than Paxlovid, which has a lot of drug-drug interactions. So we'll see.
Certainly great news. And as we move on from COVID, our first story this week is following the recent hurricanes in the southern United States. Most specifically in Florida, there has been a bit of a scary rise of a flesh-eating bacteria. Can you tell us about the bacteria
Yeah.
and the cases?
Well, this is something that's been around for a while. It's called Vibrio vulnificus. It's a bacteria that can cause like a flesh-eating skin condition. It can kill people. So because of all the damage with the water systems and flooding and sewage and everything else, they've had a big spike in cases this year compared to other years. And they've had in Florida 13 deaths already from this infection. It can be a very serious infection, and about a third of people actually die from it. So if you get these infections, you need to be treated right away, hospitalized right away, and if you need it, you have to have an amputation. It's really quite devastating. So it's not that many cases, but it's so awful that we have to just bring it to everybody's attention that this is out there. And if you've got some kind of skin infection happening, you need to be treated right away.
Mhm. Definitely seek professional medical help if you're noticing any strange things in that
Absolutely. I
region.
mean, it starts with, fever, chills, low blood pressure, and then these blistering skin lesions. And then that just gets worse, gets discolored and spreads. That's why they call it flesh eating. So it's a nasty infection, and it can be treated though, but you got to get it early.
Mhm. Our next topic, Mpox, also can be a very, very uncomfortable disease to have.
Very painful. Mhm.
And it came out this week that there was a new WHO approval for another group for that Jynneos vaccine. Can you tell us a little bit about that and if there are more cases popping up anywhere?
Well, in Africa in particular, children are infected with Mpox. A lot of kids get it. And so this is a study in young teens and adults. And they were treated with these clinical trials with this Jynneos vaccine by Bavaria Nordique. And they found that in kids that were 12 to 17 years old, who got 2 doses of the vaccine, it worked really well. So it's just, basically it works in these young kids. Young kids get the infection. They want to be protected just as well and prevented from getting this horrible disease. People can die from Mpox, so we don't, this is something that has to be taken very seriously. So you can give it to younger children, and this is good data that supports its safe use.
Mhm. Very good news. And some more troubling news out of Washington state here in the US. There are 4 potential cases of human H5N1. Can you give us the
Yeah, so
lowdown?
Washington has joined the club of workers who got avian flu. Again, like the other 20 or so people in the United States that work on these cattle or uh, dairy cow or chicken farms, um, nobody got hospitalized or died. And conjunctivitis was a common finding, which is not common with other kinds of flu. So they were really pretty much mild. They were given antiviral medication that's used for flu. They did okay. And that's great, but that's just another batch of bird flu happening there. Still no evidence up there for transmission person to person. So it's now so that those cases make it a total of 27 humans that have gotten bird flu, or 27 people had tested positive before the cases in Washington. So this is on top of the 27, excuse me. And that one case in Missouri is continuing to confound healthcare workers because there's the one patient there that had no exposure to animals, but nobody else has gotten sick. And there's a lot of holes in that story. So it's, I don't know if we're ever going to really have the answer. Um, since 2022, it should be noted over 100 million infected birds, chickens, that are sold for sale have been culled. They've been killed and eliminated. That's a lot of birds. You might notice there's some rise in chicken and egg prices is because of that, or that's a big part of it. And 322 dairy herds have been infected, but the mortality rate for those cows has been really pretty low, 1 to 2%, but in just a few of them, it was as high as 10 to 15%. We're not sure what's going on there, but it needs to really be watched closely.
Hmm. And in regards to that Missouri case, we are keeping our eye on all of the news that comes out regarding that. As of 10/18, there was no update, but we will stay on it. So if there is news to share, we will be sharing it.
It's a
But
mystery, that's for sure.
yes, big mystery. And a quick update now, looking overseas in Pakistan, there have been rising numbers of polio cases ahead of vaccination campaigns. What can you tell us about it?
Yeah, so the Gates Foundation and the Rotary International have in particular been working very hard to eradicate polio. We were very, very close, but because of all the troubles in the world and regional conflicts, that hasn't happened. Since January in Pakistan, for example, 39 new cases occurred this year. Last year it was only 6. So it's not going in the right direction. And the new vaccination drive is going to start there in 3 days. And the goal there is to vaccinate 32 million children. So, we have to keep up with this. Otherwise, polio is never going to go away.
Hmm.
And
And
it
we
can
have,
go away. It's just,
yeah,
we've got to
absolutely.
get the vaccines out to where the people need the immunity.
Hmm. And speaking of a pretty excellent reaction of public health services, the WHO has been lauding and appreciating the response to the Marburg outbreak in Rwanda. What can you tell us about that?
So Marburg, another potentially lethal disease popped up in Marburg. Excuse me, it is Marburg Virus. Popped up in Rwanda recently, and the WHO and Rwanda health people actually controlled it. And they have gone more than 7 days now without one new case, just with the public health measures that they put in place. Just being careful, wearing gloves and gowns, and isolating people that they think are infected. So this is really great. So it's a nice example of how these things actually can work if you've got the resources to just do the basic public health measures.
Hmm. Absolutely. And our final story for today is about a subject we've touched on briefly, global cholera. While deaths have been going up, cases have been going down. Can you explain that dichotomy to us?
Yeah, so it doesn't make sense when you just hear about it. You wonder what the hell is going on here. So global cholera cases have dropped 16% in the last year, but the death rate has more than doubled, rising 126%. And 2024, there were 437,000 cases and 3,432 deaths. So the deaths are up, the cases are down. So why is that? Cholera can kill you, obviously. And there are oral vaccines for this, there's treatment for this, and there's simple hydration, keeping people hydrated. And that may sound simple, but in many areas of the world, it's not so simple. Water supplies are contaminated. They don't have the infrastructure to do that. And if you look at the countries that have been hardest hit this year, it includes places like Afghanistan, Pakistan, Yemen, the Democratic Republic of the Congo, where a lot of the Mpox cases are, Ethiopia and Sudan, which has also had some troubles. So, those countries, in general, especially in many of the rural, more isolated areas, don't have the infrastructure to deal with it. And so that's why the death rate is higher. It's unfortunate, it's avoidable.
Mhm. Very unfortunate, but thank you so much for breaking it down for us, as well as all of our other stories from today. As always, your time and your expertise is very, very appreciated. Thank you, Dr. Murphy.
Well, thank you and have a great weekend.
Thank you. And thank you to all of our viewers for joining us for another episode of the Ask Dr. Murphy series. If you have any questions or suggested topics, please comment them down below or at any of our social media linked in the description. We'll see you next week and have a nice weekend.